Welcome to Evergreen Family Medicine. Today we are with the CEO of Evergreen, Dr. Tim Powell, with a preview of 2023 for Evergreen. Lots going on, Dr. Tim. Thanks for the time.
Well, you're welcome, Brian. Appreciate you being here. There is a lot. At the start of every calendar year, I put out a fairly major manuscript, and I call it the goals and objectives for that year. I put a lot of thought into that. I meet with all my leadership team. I try to nail down not only what we're going to do, but I go step by step how we're going to accomplish that, who's going to be involved, who owns this part of it. And I also try to apply metrics so that we can measure how successful we've been in obtaining that. After I've done that, my job is then to make sure everybody understands it, because it does no good whatsoever if I'm the only guy with the vision. I have to share that, I have to sell that. And so every single employee gets a copy of that. We have a town hall and I go through that. I want us all understanding together where it is we're trying to go.
So as you look into 2023 then, what are some of the big points that stand out in your outline?
Well, you don't have time to listen to them all, but I will tell you 5 that are very, very high. The first is to open up Sutherland Clinic. A lot of folks in Douglas County will know that we've been working on this clinic for some time, and it's going to open and become functional in 2023. Provider recruitment will forever be on the list. One of my major jobs at this phase in my career is bringing in really good young providers that love being in a rural area and will commit over a long time to this area. And if there's a legacy that I want to leave, it's in those lives that come. The third will be to enhance our own staff's satisfaction in the job that they do and also provide for their safety. Fourthly, it's just a broad concept of education, but when I talk about education, I'm going to talk about education of our staff, education of our providers, education of the community, and education of our patients. And then finally, there's a concept of mental health that I'll speak to a little bit, but that's a lot. But under each of those, there's a ton of stuff. But if there's 5 major billets, that would be it.
All right, well, let's start back at the top then and talk about the Sutherland Clinic. This is more than just opening a new place to do business for Evergreen.
This is a dream, really a thought that we've had since 2015 and wanted to be done. It's going to be a gorgeous building. It's nearly 20,000 square feet. It's going to have both family medicine and urgent care. It's going to be open 7 days a week, including family medicine 6 days a week. In some ways, I wish, well, you don't want to hear the difficulty we had to overcome in this time of inflation and shortages and labor supply and just so much difficulty to be able to be where we're at right now. And secondly, there's the aspect of completing the project, and then there's the aspect of filling it with really good providers, and those have to come together about the same time. But it's really, in some ways, Sutherland is symbolic of, I guess, Evergreen's resiliency, our determination to follow through on what we said we were going to do. And it's also symbolic of the faith we have in the Sutherland and North County area. We're so excited to be there and looking forward to really developing relationships. I want my providers and my staff up there to be involved in city council and on school board and just be involved in the community and become good community members.
Under the second point of provider recruitment, we talk about that all the time here. I'm always interviewing the new people that come through. I know that Evergreen works very hard to try to find the very best providers available.
You know, we do, and I think we've gotten better in learning which ponds to fish in, where to look. We added this last year 9 new providers, and that's been about the average 6 to 10 every year. We're growing, and there is absolutely that need for primary care. And we've learned we do best if we go to the rural tract residencies, places like Oklahoma, Texas, Montana, Idaho, those kind of areas, even West Virginia, and find people there and then bring them out and we want them culturally to really fit. So medicine's tough. Medicine is tough, but if you really enjoy the people that you're working with, really feel like they have your back, you're proud of the work they do, and they support you, it's much more pleasant. And so the culture that we have is very precious to me, and I want to make sure those people are real team players and have the right motivations.
Which plays right into the next point, which is enhanced staff safety and satisfaction.
Well, I'll start with safety. Brian, we live in different times right now. I wish it was different than this, but very unsettled times. And as my staff works late hours and oftentimes then walking to their car after dark, or sometimes just with folks with mental health issues or addiction issues come in and are threatening, we want to make sure our staff feels safe. And one of the things we've done to achieve that is we've brought in 2 full-time security officers, and they're excellent. They're really excellent. We're also going to give our own staff a lot of training in how to guide conversations, to de-escalate tension when they can. So there is that. The other part of satisfaction, though, is showing our staff a way forward, that there's no dead-end jobs at Evergreen. If they excel, if they show excellence, we're going to notice that, and we're going to allow them an opportunity to move up.
Another point that you want to talk about in 2023 is education. You mentioned the 4 different places where that is true. Take us through some of those thoughts.
Well, we've always emphasized education, but we're going to do that to a much higher degree going forward. We have our own certified medical assistant program here, where if folks can come totally without experience, totally without qualifications, if you will, other than a desire to do the job and intelligence and a commitment, and we'll teach them. And on the job, teach them, and then we'll provide the exam and the process where they can be certified. We've always had that. We want to formalize some of our training. We've had a fair amount of staff turnover, so that there's a core curriculum and core competencies that we make sure every one of our MAs have. And then I really want to offer to them a number of extra educational availabilities if they want to move forward, if they want to learn special areas, and we're going to involve our own providers in teaching a lot of that. And it's a way, again, of building a team when they do that. So a lot of opportunities for them to learn. I don't want to see I'll buy them lunch. I want them, but I don't want to see a lunch hour left unused if we can use it for education.
So staff, then providers, and also patients on your list of education.
You know, people think, well, physicians have been through all this school, you know, they should have it done. Believe me, we don't, and we're continually learning, and we have a lot of opportunities. We'll bring in lectures on specific topics sometimes. We do a lot of case reviews at our provider meetings. This year, we're starting something, and providers know what I mean by when I say this. It's called an M&M, Morbidity and Mortality Conference. And we're going to shut the doors. It's going to be providers only, and we're going to review cases, and we're going to be really kind but candid with each other and hold one another accountable where we can get better. And frankly, I'm looking forward to that. And then for patients, boy, is this a huge issue. We're going to start a very excellent diabetic education for our patients. We're going to utilize our 2 endocrinologists. We're going to use 2 family physicians who are both happen to be insulin dependent diabetics, and we're going to use an RN who's a clinical diabetic educator. And we're going to use all of them in a class, and then also include a visit with that where we can personalize the education with them. And it's going to be a continually rolling education program. So literally with the thousands of diabetic patients that we have, they can enter at any time. There's no wrong door, no wrong time to come in, and we'll just include them. And then after they've had the core thing, if they want to say, you know, I'd like to go back and learn a little bit more about the different types of insulins, or perhaps calorie counting or whatever, we'll have the agenda and they can attend that class again.
So staff, providers, patients, and community.
We've always tried to reach out to the community. We're going to do it a little different this year. We've had town halls, for example, on a virtual basis. COVID's over. I'm old school. I just love getting together, and we'll still do it video as well, but we're going to offer patients an opportunity to come get to know us, see us in person, ask questions. We'll have some snacks for them, and enjoy some time together as we talk about the topics that are current and relevant to them.
And the final point, mental health.
Brian, if there's one area Evergreen needs to do better, and frankly, probably medicine in general needs to do better, it is mental health. We work hard. All of our providers are comfortable dealing with mental health issues. We have a psychiatric nurse practitioner, Sue Ellis. She's actually a doctor of nurse practitioner, but it's not enough. I've been working with George Fox, and I'm working very, very hard to bring down a clinical psychologist, a PhD, to oversee our program, to bring in a lot of licensed clinical social worker, so we can respond not only in time, what we call warm handoffs, but also have some more traditional counseling available. There's certain insurances, Medicare is one of them, where it's very difficult to find counselors who will see them, and the reason is simply because it pays so poorly. But the need is enormous. We do have other areas of patient education. David Myhill, who's a wonderful person, has been holding grief classes. We're going to resume our dementia support group, which was extremely popular before. We have our chronic pain management group. So there's a lot of ways we interact with our patients, with the community in a group setting, where we have more time than we might when we're so hurried sometimes in the exam room.
Well, 2023 is here. You've got the vision. Thank you for sharing some of that with us. Most people have no idea of the amount of detail and work that goes in behind the scenes at Evergreen, but so much thought goes into everything you just talked about.
Well, thank you, Brian. It means a lot to us. It's really our mission.
Terrific. Well, you can always pay attention to what's happening at Evergreen Family Medicine on the website at evergreenfamilymedicine.com, and you can follow Evergreen online on Facebook, Twitter, YouTube, and Instagram.